Hello, my name is Dayan Siebra, and today's video was a request from many of you. What's the theme? Exactly what you might be wondering. The topic is anal sex. First of all, I want you to understand that this topic was chosen by you. I want you to open your heart. This is a very serious video. It's a video in which people sometimes joke about anal sex. Here we're going to be serious today. Of course we joke a lot, but the intention here today is to inform. I don't want you to judge me for making this video. I want you who are against it, who are in favor of it, you who are Christian, evangelical, Catholic, Muslim, whatever, to know that anal sex exists, people do it, and they run some risks if they don't do it in the best way to avoid diseases. Okay? So this video was requested mainly by women who have doubts. My husband wants to have anal sex. What do I do? So today this video is for you who have anal sex who are homosexual. It's for you who are not homosexual. It's for you who are heterosexual and have anal sex with your wife. It's for you who are a wife. It's for you who are evangelical and want to share this video with people who have anal sex. This video is for everyone. It's enlightening. But before I start talking about anal sex, I want to ask you to subscribe to our channel, which, by the way, we're celebrating 500,000 subscribers thanks to you. Cheers. If it weren't for you, this great family that constantly talks about health wouldn't exist. Guys, it's a lot to be grateful for, and I believe you must have seen our 500 subscribers live stream. It's here. Check out the live afterwards as soon as the video is finished. So, thank you very much for everything, okay? Don't forget to subscribe to the channel if you're not already. And don't forget to click on the link below, www.dslive.com.br.evento. For what? So you can buy our book, 100% Health. There you are. But do you already have the book to buy? No. This link is for you to take part in the launch. You'll be the first person to take part in the launch of our book and buy this book in particular, okay? The book about health, about our channel. So come on, let's stop talking, let's talk about anal sex. This subject is extremely embarrassing to begin with, not only for people but also for doctors. Most doctors don't want to touch the subject, even specialists like proctologists and urologists. People start off not understanding who is a urologist and who is a proctologist. A proctologist is a doctor who treats the anus, but he is a doctor who treats the lower gastrointestinal system, the intestine, the rectum, the anus. The urologist treats the urinary system, but sometimes he uses the anus to examine the prostate. So a lot of people get them mixed up. So when you have a problem in the anus, you have to go to the proctologist, not the urologist, right? Although the urologist uses the anus to examine the prostate. So we realize that some people, when we start talking about it, turn their heads away, lower their heads and feel embarrassed. I don't care. My aim is to inform you. We need to break this taboo and talk. Talk about things that are being done. I want to ask forgiveness again from many of our followers who have different beliefs. I'm not here defending how to have or not have anal sex. I want to tell those who do how to do it in the best way. There are people here who think it's a sin, who think anal sex is tasty. There are other people who think it's oniony, that it's disgusting. Others say it's the best thing in the world. Regardless of what you think, let's do it safely, if at all. People have anal sex with women. People have anal sex with men. Men with men. Women with women using instruments. Men with women. You name it. Look, maybe this is the only time in your life that you've seen a video with such complete content about anal sex. And so serious. So the first thing, the rectum, which is that end of the intestine, it's not designed for penetration, right? The rectum was made to eliminate feces. It's an extremely contaminated environment full of bacteria. What do we have in the rectum? Poop. Another big problem is that the rectum is full of vessels. There's a plexus there called the hemorrhoidal plexus. The hemorrhoids, the hemorrhoidal arteries, the hemorrhoidal veins are there in the rectum. So the chance of rupturing a vessel like that during anal sex is very high. And there's bleeding and contamination. And there's a high chance of contamination by the HIV virus, syphilis and other diseases. Therefore, anal intercourse or anal penetration needs a condom, okay? Imagine that the rectum has a muscle, an anus muscle. It's a muscle called the anal sphincter. It's what holds the poop in so that it doesn't fall out. Otherwise, you'd poop all the time. So this is the muscle that works hardest in our body. Yes, it is. Apart from the heart muscle, this muscle doesn't stop. People only value the heart, but they don't value the anus. Why is that? Because it contracts all the time. When does it relax? When you go to poop. So since it's a muscle that gets a lot of exercise, what happens? It's strong. So if you're going to have anal sex, you need to relax it. So the person who is going to have anal sex with you, the person who is going to receive your penetration, has to be extremely relaxed and want to have anal sex. It can't be forced because the person has to be relaxed. Otherwise, you could cause the person receiving anal sex to develop a condition called a fissure, which is a crack in the anus. And a fissure causes pain, bleeding, and can sometimes even lead to surgery. The sphincter can tear, in other words, the muscle can tear if there is no relaxation. And look, there are serious cases where the person goes to the hospital emergency room with heavy bleeding from the rectum. I've seen patients in the emergency room in the early hours of the morning because there was such violent anal sex, the excitement was so great, it started to bleed. And sometimes you go to the operating room, open up the belly so you can correct the laceration of the rectum due to anal penetration without relaxation, without lubrication, without all the preparation. So I'm going to talk you through 6 practical steps so that you can have anal sex a little more safely. Will it be 100% safe? No, but a little safer for those who are actually going to do it. First step, lubricate the anus and penis. People lubricate the anus a lot, but they don't lubricate the penis with water-based lubricant. You have to lubricate both and always with a condom. The second step we've already talked about, condoms. How are you going to have anal sex and enter with your penis or, I don't know, your partner, I don't know. How are you going to enter a place full of feces with your penis without a condom? The poop will get into the urethra and will at the very least cause urethritis, which is an infection of the urine duct. Step 3. The anus needs to be relaxed with your finger. And then I need to explain this to you. When you do a rectal tap, and we do rectal taps, our patients, you push the anus with your finger so that it relaxes. You push the muscle with your finger so that it relaxes. After he relaxes, you penetrate. It's the same for anal sex. You have to massage the anus for about 5 seconds. Massage lightly, until you push it in. You don't have to come in all at once. After that, you put in the penis or the vibrator or whatever you want to put in. I don't recommend putting instruments in the anus. When I was a surgical resident, I operated on several people taking vibrators out of their anus, deodorant, pet bottles. People, it was impressive. Step 4. Did you know that the rectum, the part of the intestine near the anus, is not a rectum? It's not straight, it's curved. And did you know that penises aren't straight either? It has its curvature. So if the curvatures go against each other, you can lacerate the rectum. So the penis has to be introduced towards the navel of the person receiving the penis. Intercourse should ideally take place on its side. Step 5. Slow sex. It's not vaginal sex. Vaginal sex, you sometimes go at it with desire, but no. Anal sex is slow, right? Slowly, because the vagina is able to receive the blow. So it's all about the energy, the excitement. But not the rectum, it goes slowly. Then you'll lacerate. You'll contaminate yourself, you'll bleed, and you'll go to the emergency room at dawn. 6th and final step, anal sex. Only if you're both into it. Regardless of whether you're homosexual or not, whether you're a husband, wife, or man, talk to your wife if you want to have sex with her. But if she doesn't, let her. Don't push it. I see a lot of men who force it. I want. And the woman does it to satisfy her husband. Woman, if you think you should satisfy him, work on your mind. This video is not to convince you to have anal sex or not. It's so that if you do have anal sex, you take the 6 steps we've talked about. Okay? So comment down here what you thought. Comment down here with your doubts if you have any more questions. If you haven't watched our video on oral sex, click here. This video on anal sex came from oral sex. You put me in every position, on every subject you find for me to talk about. But I do everything for you. Another thing, don't forget to like this video. Also, don't forget to sign up for our event. Here's the link in the video description to the launch of our book. Cheers. Live healthy, live with passion. Share this video with everyone you know. Because there are people who have anal sex and don't tell, don't spread the word. So share it because you could be helping them to prevent disease. Big hugs.